So Tucatinib was recently FDA approved in conjunction with trastuzumab and capecitabine to be given in the second or third line setting of patients who have HER2-positive metastatic breast cancer. And the approval was based on the findings from the HER2CLIMB randomized phase 3 trial. As you'll recall, this was a phase 3 trial that randomized patients to Tucatinib, trastuzumab, and capecitabine, or a placebo, trastuzumab and capecitabine. Patients were randomized in a 2-to-1 fashion to the triplet versus capecitabine and trastuzumab with the placebo. And what was found was a significant improvement in progression-free survival of more than 2 months, and very remarkably, an improvement in overall survival by over 5 months, actually almost 6 months, for those patients who got Tucatinib in conjunction with capecitabine and trastuzumab. This has really been practice changing. What was really very interesting about this trial was that the trial enrolled a significant proportion of patients with brain mets. So almost half of the patients who participated in this trial had brain mets, either previously treated or previously untreated, and even progressive, as long as patients didn't require urgent management of their intracranial metastases. They were allowed to enroll in HER2CLIMB. And in those patients who had brain metastases, there was a similar improvement in progression-free survival that was seen, which is remarkable given how poor prognosis is with patients who have CNS metastatic disease. So this has really given a lot of options for patients who have intracranial brain metastases. So in patients with brain metastases who participated in HER2CLIMB, the response rate when Tucatinib was added to trastuzumab plus capecitabine was more than double what it was with capecitabine and trastuzumab alone. 47% of patients who had intracranial disease had intracranial response to therapy, which was much higher than what we saw with the capecitabine and trastuzumab arm alone, where the response rate was only 20%. So I think this is a very important option for those patients with brain metastases, and could very well lead to a delay in needing radiation, and certainly is associated with a much better quality of life. As someone who's used Tucatinib as part of the HER2CLIMB trial, I had a number of patients who participated in the trial with brain metastases, and after they were unblinded, I found out that they did, in fact, receive Tucatinib and actually had very nice response intracranially to the regimen. So I think it's a really exciting regimen to be able to offer patients, particularly those with brain metastases, because it may help to delay the need for radiation.